All right, today we're stepping into what is, without a doubt, one of the most high-stakes environments in any hospital, the pharmacy. I mean, this is a place where precision isn't just a nice-to-have, it is an absolute life-saving necessity. So we're going to explore how automation is stepping up to solve some truly life-or-death challenges.
So what if a simple workflow error could be life-threatening? I mean, really let that sink in for a second. In most of our jobs, right, a small mistake is, well, it's a setback, it's annoying. But in a pharmacy, the stakes are just on another planet. The wrong medication, the wrong dose, that's a nightmare scenario that keeps healthcare professionals up at night. And that is the central problem technology is trying to solve here. And the reality is, that risk gets cranked up to 11 by the insane daily pressure. You've got pharmacists and technicians just navigating this constant storm, right? Urgent requests are flying in, there's this incredible pressure for speed, and on top of it all, they're managing these huge, costly inventories. And all this is happening while they're stuck doing these repetitive manual tasks that, let's be honest, leads straight to fatigue and burnout. It really is the definition of a pressure cooker environment.
Okay, so now that we've got a really clear picture of the problem, let's bring in the solution provider we're looking at today, Swisslog Healthcare. Now these guys are a global leader who are focused on one thing, automating that entire medication management process. We're talking from the second a drug arrives at the hospital all the way to the moment it's ready for a patient.
Now what's really interesting here is the muscle behind them. Swisslog Healthcare is actually part of KUKA, and if you know anything about automation, you know KUKA is a global powerhouse in robotics. So think about what that means. This isn't some healthcare company just dipping its toes into tech. No, this is a company with some serious automation DNA, and they are laser-focused on solving these massive logistical headaches in healthcare. And a real game-changing moment for them happened back in 2017. They acquired a company called Talyst Systems. Now, this wasn't just buying up a competitor. It was a super strategic move. They basically brought in all this powerful software and specialized hardware, making their whole solution way more complete. You could say this was the move that really paved the way for what they now call their automation ecosystem.
Which brings us right to the heart of their whole strategy, this idea of an automation ecosystem. And listen, this isn't about just selling a hospital a cool robot or a single piece of software and calling it a day. Not at all. It's about creating this fully connected, end-to-end solution that tackles every single one of those pressure points we talked about earlier.
So what does that actually look like? Well, let's follow the journey of just one pill. First, it gets checked into a super secure automated storage system. Then, when it's needed, robots step in to handle the really precise dispensing and packaging. From there, automated transport systems, think like advanced pneumatic tubes, whisk it exactly where it needs to be. And the whole time, a smart layer of software and analytics is watching over everything, making sure every single step is tracked and totally optimized.
Okay, so here's the most important part, the thing that makes it a true ecosystem. It's the integration. It's the fact that you don't have these separate little islands of technology that don't talk to each other. Instead, you get this one seamless workflow. The storage system talks to the dispenser, the software tracks it all, and that data is used in real time to cut down on waste. Everything is working together in perfect sync.
Now, all of that technology sounds amazing, right? But what does it actually mean in the real world? What kind of progress does it deliver? Let's shift gears from how the tech works to why it matters. You know, the real, tangible results for the hospital, for the staff, and, of course, for the patients.
And honestly, when you put them side by side, the difference is just night and day. On one side, you've got the old way of doing things, the manual workflow. It's high risk, it's slow, and it has your most skilled people tied up doing logistics. But on the other side, with the automated workflow, it solves every single one of those issues. You get fewer errors, faster dispensing, way less waste, and this is the real kicker, it frees up your clinical staff to actually focus on patient care. And let's be crystal clear about the #1 most important benefit here, patient safety. By taking human error out of all those repetitive parts of the job, the counting, the picking, the tracking, automation drives a huge reduction in medication errors. And in a place where there is absolutely zero room for mistakes, that is the most important result, period.
This chart really paints the picture of where everyone's time goes. See how automation just slashes the time spent on all those manual tasks and wrestling with inventory? So what happens to all that time that's saved? It gets funneled right back into what matters most, patient care. Your staff can finally spend more time consulting with doctors, verifying prescriptions, doing the critical, high-value clinical work they were actually trained to do.
Okay, but of course, a massive transformation like this doesn't just happen overnight with the flip of a switch. So to give you a really balanced picture, we need to talk about the key things you have to consider to make sure a transition like this is actually successful.
Now, you shouldn't think of these as roadblocks. They're more like critical planning steps you have to get right. First, there's obviously the upfront investment, and that means you've got to do your homework on the return. Then, there's integrating all this with the systems a hospital already has, which means you need a solid plan for training and managing that change. And of course, you've got regulatory compliance, and this one's huge, making sure you have around-the-clock support. In a hospital, that is absolutely non-negotiable. So, as we bring this all together, let's just zoom out for a second and look at the big idea here. Because this is about so much more than just being a little more efficient. This is about building a pharmacy that is fundamentally future-ready, one that's built to handle the challenges that are coming down the line. And you know, I think this quote really just sums it all up perfectly. For any healthcare institution looking to modernize, Swisslog helps you realize those gains, freeing up clinical staff to focus on patient care rather than manual processes. That's it right there. The tech is the tool, but the ultimate purpose is human, letting skilled people do the work that only people can do.
And so we'll end on a question, and this is for any healthcare leader out there. When you look at the growing demands on our health systems and the absolute need for more safety and more efficiency, you have to ask yourself, is my pharmacy designed for tomorrow's challenges? It's a really critical question to think about. Thanks so much for watching.